Good morning, friends. I am Dr. Pankaj Maheshwari. I am Chief Urologist and Senior Consultant at Fortis Hospital, Mulund. You know, anything which is common will have more myths. The commonest myth is that when a cat crosses your path, it is a misfortune. The real misfortune will be if a lion crosses your path, but because that is not common, we blame the poor cat. Stone disease being extremely common has a lot of myths. Every patient who walks into my room tells me something new about stone disease, and sometimes it is to the tune of being extremely funny. The commonest myth is that beer dissolves stones. Friends, I am going to disillusion you. I may be disappointing you to tell you that beer does not dissolve stones. If anything, beer increases stone formation. Beer has a lot of uric acid, a lot of oxalate, so a regular intake of beer may increase the chance of stone formation and not dissolve it. So if you want to have beer, it is your choice. Don't blame your stone or a urologist for having beer. I have had patients who have forced their spouses, their kids to have beer, hoping that stone would come out. Surely this does not help. The impact of having 2 glasses of orange juice and maybe a bottle of beer will be exactly same. Probably the kick that you get out of a beer would not be there in the juice. That probably is the only difference. So let's be very clear. Alcohol does not reduce the stone. Alcohol does not dissolve the stone. Rather, no medicines dissolve stones. Whether it is allopathic, Ayurvedic, homeopathic, there are no medicines which dissolve stones. Stones only get flushed out. So we can give treatment for the stones to get flushed out in urine. Interestingly, only uric acid is one stone which can get dissolved, but bad luckily in Indian population, pure uric acid stones are extremely rare. So do not look for a treatment which dissolves the stone. We have to look for treatment which either flushes out the stone or treatment options which would reduce the stones like lithotripsy or endoscopic treatments. More commonly, a lot of vegetables are blamed for stone formation. I have had patients who stop tomatoes, palak, brinjal and whatnot, hoping that stones would stop. People remove seeds from the vegetables and hope that seeds cause stones, and hence having seedless tomato probably will help them prevent stone formation. Let's look at tomatoes, for example. How many tomatoes does a normal person have daily? Probably half, probably one. It may be there in your dal, it may be there as a part of your vegetable. Nobody eats half a kg tomato every day. So that half tomato will not cause any change in your oxalate levels. So do not reduce your lifestyle by stopping tomatoes or brinjal, or for that matter palak. How much palak does a person have in a month? Maybe once or twice. This will not impact stone disease. Stone disease will be impacted only by things which are there in your day-to-day diet. The last myth a lot of people feel is that once you form a stone, you need to become vegetarian, because even non-vegetarian diet is being blamed to form stones. No. If you like your meat, you are permitted to have them. Egg, chicken is absolutely safe from stone point of view. Red meat should be reduced in frequency and in amount, and whenever you have red meat, add a vegetarian dish with it. So you do not need to become vegetarian. Have your diet whatever you like, but keep a watch on the amount and frequency of red meat in your diet. So what do I need to do? I revise the same things. Drink a lot of water, enough to produce 2.5 liters of urine. Have regular exercise. Reduce salt in your diet. Maintain a healthy lifestyle. Manage your weight well. Yeah, one important last thing, strictly stop smoking. You know, nicotine comes out of our body through the urinary system. So if there is nicotine in your urine, this nicotine will cause small punctures in the urinary mucosa in which crystals deposit and can grow to stones. So smoking is one important cause for stone formation and stone recurrence. Last care that you need to take is remember that stone is a recurrent problem. So keep on checking regularly for stone recurrence. Once I form a stone, I should get a sonography done at least once a year. How do I remember to get a sonography done once a year? Gift yourself a sonography on your birthday. That way you will not miss getting a sonography done. If you do a regular sonography, you will catch a stone when it is smaller than 5 millimeters. And if you catch it when it is smaller than 5 millimeters, surely we can treat it with medicines. Avoid myths, be realistic, have realistic lifestyle changes, and surely you will have a better quality of life with stone disease. Best wishes.